The CDC has overhauled its recommendations for childhood vaccines schedule. The change cuts the number of routine inoculations from 17 to 11, and vaccines for diseases like rotavirus, influenza, RSV, and hepatitis A and B are no longer recommended for children. Joining us, co-director of the Center for Vaccine Development at the Texas Children's Hospital and Dean of the National School of Tropical Medicine at Baylor College of Medicine, Dr. Peter Hotez. He is also the author of the new book, Science Under Siege. All right, doctor, what's the risk here? What about these 6 vaccinations that are no longer going to be recommended for children? Why is that a problem?
Well, there's 2 parts to this, Katie. One is the gaslighting from their documents and their public statements, and the second is just awful, non-evidence-based, terrible public health policies being implemented. I don't know how else to say it. The gaslighting part is to say, well, now there's going to be shared decision-making for 6 vaccines instead of coercion. It's nonsense. I mean, I don't practice pediatrics anymore, but when I did, and when I was, I'm mostly in the laboratory as a scientist, but, when I practiced pediatrics, both as a house officer in Boston and afterwards, there was never coercion. You'd have a discussion with parents on the risk versus benefits of vaccines, and parents would be all in once you laid it out how awful these diseases are. Like when you've taken care of kids with meningococcal meningitis and they lose their kidneys and they lose their limbs and they have permanent neurologic disability. It becomes self-evident. So that's the first piece. The other gaslighting is they say they're only going to focus on European consensus vaccines. There's no such thing. That's a made-up term. What these are is each European country decides, based on the epidemiology of the diseases, which vaccines they would use. And anyone looking at any head of a Department of Health or a Minister of Health for a European country would look at the U.S. numbers for things like rotavirus and meningococcus, and absolutely they would say this is a highly recommended vaccine. So that's nonsense. So what is this going to do now? The risk is some of these diseases are going to come back, on top of the fact that we've already had the return of measles this year. So we're in imminent danger of losing our measles elimination status after it was eliminated in 2000. Measles is back. Pertussis, whooping cough, is back. And now they want to bring back diseases such as horrific meningococcal meningitis and meningococcal septicemia, one of the worst diseases I've ever seen, taking care of kids in the pediatric intensive care unit. They want to bring back rotavirus, which caused, in the pre-vaccine era, 50,000 to 70,000 hospitalizations a year and killed hundreds of kids and cost the United States $1 billion. There is no way you could justify any of these actions on the basis of science or anything remotely related to cost-effective, sound public policy.
If you are a parent who still gets all of these vaccines, believes in them, are your kids still at risk of contracting these viruses?
Well, remember, no vaccine is perfect. I think that's an important point to make. And so what's this going to mean? It means when you send your kid to college, or if you send your child to a boarding school, this is where we used to see terrible meningococcal septicemia epidemics. And so now that's... Can
you just do me a favor and explain exactly what it means what those diseases look like? What meningococcal septicemia looks like?
So meningococcus is caused by a bacteria called Neisseria meningitidis, and what it does is it gains access to the bloodstream after colonizing the mucous membranes of your nose and mouth and throat. And when it gains access to the bloodstream, it seeds the central nervous system and causes meningitis and seizures and permanent neurologic disability. It goes to the skin and causes necrosis of the skin and causes a horrific condition called purpura fulminans because it completely changes your coagulation system. So what you do is you lose limbs. So kids will lose their lower, if they survive in the first place, it has a high mortality, a 10 to 14% mortality if you get meningococcal septicemia or meningitis. And if you survive, you lose your lower limbs, you lose your fingers, you lose your hands. It wipes out the kidneys. It causes kidney failure. I can't imagine a and of all the diseases I've taken care of in kids over the years, and is probably that's one of the worst ones. And this is the one that now Bobby Kennedy and HHS wants to make optional, or a shared decision, basically to discredit or throw doubt into parents' minds about the safety and effectiveness of the vaccine when it's one of the most safest, most effective vaccines we have.
Losing limbs, if you survive it, does not sound great. Dr. Hotez, always really good to have you. Thank you very much for really just laying it out in stark terms. Appreciate it.